Amidst great anticipation and importance, distinguished guests converge at the Lagos State University Teaching Hospital, LASUTH, for the commissioning of the Sickle Cell Care Centre. Among them, notable figures like Governor Babajide Sanwo-Olu, Deputy Governor Obafemi Hamzat, Nigerian Minister of State for Health and Social Welfare, Dr. Tunji Alausa, and Senior Special Advisor to the President on SDGs, Princess Adejoke Adefulori, graced the occasion with their presence.
Governor.
As the event unfolds, the program kicks off with speeches from key figures, starting with Professor Adetokunbo Fabanwo, the visionary leader of LASUTH, take the podium, expressing his gratitude and emphasizing the significance of the Sickle Cell Care Centre in enhancing healthcare services.
The entire LASUTH family welcomes Mr. Governor to our premises today. We are delighted to have you and the other accompanying officials here on this epoch-making occasion when once again the Office of the Sustainable Development Goals, headed by our benefactor, former Deputy Governor of Lagos State, Her Excellency Princess Adejoke Adefulori, has come through for us. Mr. Governor, you will recall that about a year ago, we commissioned the magnificent multipurpose building, also donated by the Office of the SDGs. Luxury hospital accommodation suites is ongoing, also a donation of SDGs. We also have the firm commitment of that office to upgrade and expand our heavily oversubscribed and usually crowded dental center. There's also a promise of another set of multi-story buildings to replace dilapidated bungalows, also from the Office of the SDGs. The way things are going, Mr. Governor, I am strongly convinced that next to your good self, the name of the Madam SDG will be written in gold in the annals when the history of LASUTH is being written. Once again, Ma, I say thank you. What we are commissioning today is the Pediatric Sickle Cell Centre, which houses facilities for clinics, ward admissions, daycare center, investigations, as well as educational and research activities, exclusively for children afflicted with sickle cell disease. Sickle cell disease is a fairly serious inherited blood disorder that is prevalent in Nigeria. It affects the body's red blood cells and causes them to sickle and leads to various complications. Nigeria has one of the highest rates of the disease in the world, with up to 3 million people living with the condition. The condition also contributes significantly to childhood mortality and morbidity. It is therefore apt to have a center like this to offer preventive and therapeutic care to child sufferers. The establishment of this center will take a huge chunk of load off our usually crowded pediatric clinics and wards. In the center, child sufferers will have the benefit of a very conducive environment to be attended to as outpatients, and those that need daycare can be admitted just for the day and treated, and they will go home. Those that need prolonged admission can also be admitted. LASUTH is indeed blessed to have a dedicated team that looks after children with sickle cell disease. Our pediatric hematology unit is headed by the very hard-working and committed Professor Ijeoma Akinwumi. I think she's around. Bosita, don't hide in the corner. Let the governor see it. Yes. Professor Akinwumi will be speaking shortly to give more details about the operations of the center. Professor Ijeoma Akinwumi, consultant pediatrician, specialty in pediatric hematology, special interest in sickle cell disease. Mr. Governor, LASUTH and indeed Lagos State, under your leadership, is blessed to have been able to attract donors, partners, benefactors who make the burden of healthcare management lighter for us, the government. As we speak, sir, the Redeemed Church of God is constructing for us a 4-story pediatric oncology center where children with childhood cancers, and the numbers are increasing every day, can be managed. It's a 4-story building. The Rotary Club of Maryland is putting up a relatives' quarters, and this is a 2-story building which will accommodate relations of patients who may not be able to go home. As we speak, they sleep anywhere all over the premises. Some even sleep in their cars for days. So we thought of this idea, and we're going to have these quarters. It will be shared accommodation. They will pay peanuts, and they will sleep comfortably overnight. It's being sponsored by the Rotary Club of Maryland. The Lions Club of Ilukweju has built an extension to our diabetes clinic, and it is going to bring succor to the very many diabetic patients that come to our clinics. Now they have a larger space. It's going to be commissioned later this month, sir. Another benefactor, who I will not name for now, is about to commence the construction of a 4-story high hospital. It's somebody that we all know, but I want to keep it under wraps for now. When it starts, we will all get to know it. Sir, Mr. Governor, sir, our strategic infrastructural plan in LASUTH is to gradually phase out our old and dilapidated bungalows and replace them with multi-story buildings. And gradually we are doing them. This pediatric sickle cell center used to be a bungalow. So we knocked it down and put up this structure, but the ward that used to be in that bungalow is now going to find accommodation in this ultra-modern building. Today, Mr. Governor gives us an opportunity to gently blow our trumpets a bit. LASUTH has been able to attract public-private partnerships which are of immense benefit to Lagos citizens. Our cardiac catheterization lab is the only functional one in Nigeria in any state-owned facility. In the last 2 years, Mr. Governor, we have carried out about 250 life-saving procedures in that laboratory. We also have an ultramodern 13-bed renal dialysis suite, also under a PPP arrangement. As we speak, work is ongoing to set up a PPP 10-bed additional intensive care unit and 4-bed high dependency unit in order to significantly expand our critical care capabilities, which is a much needed intervention at this time. At the completion of that project, sir, our hospital will now have a total of about 24 intensive care beds. This is a number that we consider fairly comfortable for now to be able to cope with the increasing numbers of patients who need intensive care. We are also setting up PPP dental suites and PPP operating theaters. We've just started our VIP, accelerated VIP consultation. We saw the first patient yesterday. He has a video. He is very happy about the kind of care that he received. This service is for high net worth individuals who would pay a little amount, and the consultant will come and meet them in the room where they are. If they need to have tests done, the blood will be taken from them there in the room where they are. If they have drugs prescribed for them, the drugs will be collected from the pharmacy and given to them right there where they are. And they will go home happy. And transport an almost dying patient safely in that ambulance to where he will receive care. Oxygen cylinders, anesthetic machines, monitors, ventilators, everything is inside that ambulance. Another donation from the Office of SDG. Once again, Mr. Governor, I'm so delighted that you are here today. We do not take it for granted. God bless you. God bless Lagos State. Thank you very much.
Following Professor Fabanwo, Professor Akinwumi Ijeoma, the driving force behind the Sickle Cell Care Centre, share our vision, underscoring the centre mission to improve the life of sickle cell patients through early detection and comprehensive care.
Not go into the epidemiology of sickle cell because Professor Fabanwo has gone into that quite a bit, but it's important to say that sickle cell disease considerably contributes to deaths, the under 5 death figures that we have for children 5 years and below in West Africa, about 16%. So if the Sustainable Development Goal 3.2 will be achieved by 2030, reducing avoidable deaths from complications of sickle cell disease in childhood is a very good place to start. Although survival has improved to up to 50% in recent years, given to up to 40 years of cumulative research to find various interventions to prevent and to reduce morbidity and mortality from sickle cell, Nigeria has been lagging behind. And Nigeria is lagging behind despite having the highest burden of sickle cell disease worldwide. Seek independence from their parents, so they default from clinics and die from things that are preventable. And sickle cell disease is a multi-organ disease which requires compulsorily multidisciplinary management. This pediatric sickle cell center is a well-equipped 10-bed daycare ward for short admissions like the CMD mentioned earlier, and many things can be managed that way. This would relieve the burden of our overbooked bed space and reduce waiting time, which has been a perennial problem. We also offer in this center genetic counseling services by trained genetic counselors amongst our staff, and among parent volunteers that we have trained and continue to train. We offer preventive interventions against the greatest enemy, that is infection, for death, and also they die from infections mostly because they do not arrive early. So these delays will be mitigated by the structure and the pattern or the modus operandi that we have put in place. We have facilities for risk assessment for stroke. Stroke is rare in children, but in children with sickle cell, it is 333 times more likely to occur than in children who do not have sickle cell. So we are able to prevent up to 90% of strokes with an evidence-based intervention that we call stroke risk assessment using a TCD machine, which we also have in LASUTH. The center houses laboratory services, a pharmacy, and a portable X-ray machine just to provide their needs in one location. In effect, it is a one-stop center for sickle cell care at its best to yield best outcomes. Training and retraining of staff and parents and children with sickle cell is actually the key to achieving best outcome in sickle cell. And for that reason, we have a 100-seater conference hall in this building for this purpose. Research has driven the improvement of sickle cell outcome worldwide over the past 40 years. We will not be left behind. We have a beautiful, completely furnished facility for research to house our research collaborations, our research work, and also to provide educational materials for the populace, the children, and their families, and anybody who considers themselves a stakeholder for any reason. We also have transition services, like I mentioned before, are very critical, and because as they survive into adulthood, they have new needs that have to be met. And I'm glad to report that our adult sickle cell clinic actually has people with sickle cell who are up to the age of 65, 68, and 70, and I applaud that. It is important to note that it is unethical for us to identify these babies and not give them optimal care as much as we are able. So this center, this beautiful, fully air-conditioned center, creates a beautiful ambience for us to achieve this. The doctors are happy, the nurses are happy. And I would say that I have a formidable team, part of whom are enjoying what we call a staff exchange program from the ARISE project, which is a European Union funded project to equip people to improve the care of sickle cell disease in Africa and Lebanon. So amongst them I have pharmacologists, clinical pharmacologists, seasoned pharmacists, nursing staff that are empathetic and excellent in their work, laboratory staff who are very experienced and committed to the cause of sickle cell, as well as information technology experts and my humble self. I thank the management, the CMD, sir, and his management team, the HOD of pediatrics, and for all their support and hard work, and in identifying these needs of children with sickle cell. I thank you, ma'am, for running with this vision. I thank you for seeing it to fruition. I bless you from the bottom of my heart. I'm emotional about this. It's been dear to my heart, but it remained a pipe dream. I am so thankful. God will bless you and reward the labor of your hands. Thank you very much.
Princess Adejoke Orelope Adefulori, representing the highest echelon of government, speaks to the crucial role of the Sickle Care Centre in advancing sustainable development goals and ensuring inclusive health care for all.
It gladdens my heart to be here today as I join the Governor of Lagos State to officially commission this state-of-the-art Sickle Cell Care Centre at the Lagos State University Teaching Hospital, LASUTH. This facility is one of many strategic health interventions that we have constructed and equipped by our office as intervention program all across Nigeria. Let me from onset appreciate our leader, our father, the President of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, DCFR, for his leadership and commitment to the achievement of the Sustainable Development Goals through the lens of its administration tagged the New Hope Agenda. In the same vein, I would like to thank and appreciate my brother, the Governor of Lagos State, Mr. Babajide Sanwo-Olu, for your unwavering commitment to the social economic transformation of Lagos State with your team and our collective desire to achieve the Sustainable Development Goals in Nigeria. Distinguished guests, recall that world leaders adopted the 2030 Agenda for Sustainable Development at the 70th session of the United Nations General Assembly, popularly known as UNGA, in September 2015. The 2030 Agenda for Sustainable Development envisions a present and a future that is economically sustainable, socially inclusive, and environmentally resilient. This agenda must be achieved by the three tiers of government: the federal government, the state government, and the local government, where the problem actually lies. What we are doing in our office is to coordinate your activities of the local government, coordinate the activities of the state government, coordinate the activities of the federal government through the ministry, agencies, and departments of the federal government, and report to the United Nations. And by extension, we intervene in critical areas. Our own is interventions in critical areas to support the sub-national government. And that's what we are doing today. This is what we are here to commission today. It may interest you that I lost my immediate junior sister at the age of 29 to sickle cell disorder many years ago. I got traumatized, and the trauma still lives with me. And that also contributes to why this project must be implemented. And I promise that we will do more for Lagos State and do in many other states of the Federation.
Dr. Tunji Alausa, Nigerian Minister of State for Health and Social Welfare, reinforces the importance of commission building in providing vital healthcare services and improving the quality of life for sickle cell patients.
My distinct pleasure to be here today at the commissioning of the Sickle Cell Disease Center, a generous donation from the Office of the Senior Special Assistant to the President on SDG to the Lagos State Government. This event marks a significant milestone in our ongoing collaborative efforts. President Bola Ahmed Tinubu is solidly, happily, and deeply committed to sickle cell disease alongside malaria, cancer, hypertension, diabetes, and other non-communicable diseases represent a substantial health burden for our nation. These diseases have now overtaken communicable diseases in terms of morbidity and mortality. As they are commonly known, they do not only affect individuals, but also place immense strain on families, communities, and healthcare system at large. At the federal level, we recognize the urgent need to address these challenges head-on and are committed to building a robust infrastructure to manage and mitigate the impact in collaboration with our subnational government. The establishment of this state-of-the-art Sickle Cell Centre is a testament to the dedication of SDG Office to provide quality health care and infrastructure to our people. I'm informed that this center is designed to offer comprehensive care from early diagnosis and treatment to ongoing management and support for patients and their families. This center is not merely a building, it's a beacon of hope for many and a cornerstone of a strategy to enhance healthcare services nationwide. I urge the Lagos State government to make optimal use of this facility. It is imperative that we leverage these resources to its fullest potential ensuring that it delivers on its promise to improve lives. This center, I'm sure, will become a hub of excellence, providing top-tier care, driving innovative research, and fostering an environment where healthcare professionals will thrive. Furthermore, I encourage all our subnational government to form strategic partnership for healthcare and human capital development. Collaboration is the key. By working together, sharing resources, knowledge, and best practices, we can build a resilient healthcare system capable of meeting the diverse needs of our population. Public-private partnership, alliances, and non-governmental organizations and international collaboration can amplify our efforts and accelerate progress. In closing, I extend my heartfelt congratulations and heartfelt gratitude to the Senior Special Advisor on XTG, Mrs. Adejoke Orelokwe Adefulere, and her entire office for the invaluable contribution to the nation, and especially to the good people of Lagos for their continued commitment to healthcare. Before I close, I would not be doing the government and the people of Lagos State the right favor by not acknowledging the excellent work that the governor of Lagos State is doing.
Governor Babajide Sanwo-Olu, the visionary leader of Lagos State, delivered a stirring speech affirming the government's dedication to healthcare innovation and the well-being of its citizens.
I think it's the importance that we all put to sickle cell anemia and the seriousness this disease has negatively in our society and in our family, that in one form or the other have been afflicted by this illness, and that the treatment and management that we still find very difficult, to fully come to terms with, that we think this occasion, and we believe and we see this occasion as very, very important. And so it is with great sense of pride and honor that I stand here as your governor to come and hand over, because we're not just coming here, we're handing over this remarkable project, very remarkable, simple, but very remarkable, very strategic in our health delivery value chain. A Sickle Cell Care Centre for the pediatrics, which has been exceptionally facilitated and built by the Office of the Sustainable Development Goals at the presidential level. But this office is led and headed by Princess Adejoke Orelokwe Adefulere, OFR. And I believe this is a testament to all of our collective commitments to improving healthcare, the outcomes that it has on our children, and of course, all the conversation around sickle cell diseases. Princess Orelokwe obviously has other choices, but she chose, having also listened to her story, that she believes that our own modest development and achievement in Lagos, she can also support us at putting this structure and this facility together. And through you, I want to also commend the leader and the heads of these units, led by Professor Ijeoma Akinwumi, who also have energized her, and we're seeing the result of that collaboration here today. And so I want to congratulate you, our SSA, for your unwavering commitment to healthcare advancement that has made this center a reality. You're indeed a woman of great vision, and you continue to show that, that at all times, you have advanced your mind to your work, and you've shown that indeed, when we collaborate both at the subnational and at the national level, there's a lot of support that we can get. But she has hit the struck, and she has struck it very well. So I've introduced her to also, she knows her very well, Dr. Orefini, our own cabinet member, who is a special advisor on SGD in Lagos. So I've said to her and to Princess that the code that she's using, the strategy that she's using to access funding on a regular basis, Dr. Fini too should also go about and begin to display it at the senatorial and the local government level. You can see that she has said that you want to bring her to me, the financing and the funding for it. she'll transfer you to Dr. Refini as well, and she too, as the special advisor on SGD, she can begin to commission structures at the 3 senatorial and go around our division and go around our local government and begin to implement. How she does it, you will ask her. The money doesn't necessarily have to come from me, but how she does it, all work together at the national, at the sub-national, and even at the local government level. We can achieve a lot more together. We can achieve a lot more working collaboratively, ensuring that at all times that the best fit is put forward on the job. I would like to therefore acknowledge the collaborative efforts of the Lagos State Government, the Office of SGD to the Mr. President, but more importantly, the collaboration that we have seen with the management and the staff of LASUTH. Your dedication at work, this donation, in my view, goes to show that what he has done before now, right, you have utilized it or you are utilizing it very well, and that has in fact encouraged her to also want to come back. This will provide a comprehensive care that will include early diagnosis, advanced treatment, and continuous management to children that are suffering from this debilitating condition. It will also serve as a hub for research, education, and education is also the cornerstone of why LASUTH is also in existence. It's a training ground, not just a teaching hospital, but it's a place of research, it's a place of education, and it reaches out to its community. And we believe this will foster a greater awareness and a deeper understanding of the sickle cell disease. This will not only transform our total healthcare landscape, but will definitely add to the number of child care facilities that already exist in our state health institutions, thus raising the capacity of the state medical services, and very importantly, contributing to improving the state infant and maternal mortality index. And I think they have also mentioned that our state government, with the support of our House of Assembly giving us all the approvals, we're building what we'll see at the end of the day, that will be the biggest pediatric children's hospital in the whole of West Africa, the new massive children's hospital. It's going on, and we believe that we should be completing it sometime next year. We'll push the contractor to ensure that that edifice, it's not only top class, but it's also world class. But I think it's also important for me to thank and to acknowledge the great support we're receiving from the Honorable Minister of State, who within a year have also used this office to ensure that we can activate another federal medical center, in Efe. That for us is another milestone, because what that will do for us is it will give us, greater access to healthcare, facility at a higher level, because we will see a lot of federal support, we will need a lot of federal funding, into that facility. And so the two of them, both the senior special assistant and our Minister of State, are our part of our people that were donated, to Abuja, and they are representing us very, very well. So, Minister, thank you again. But we'll always need to come and knock on your door. So we believe that this center, in our view, will further nurture an environment where children can receive holistic care tailored to their individual needs, from medical treatment to psychological support. And we believe that this will ensure that every child that has an opportunity to come to this facility will come out healthier, will come out better, and they will be able to fulfill, life. At this junction, I think it's important for me once again to also thank your CMD, who in his speech has used the opportunity to roll out, a ministerial briefing, on all of the achievements, of LASUTH. But we're not there yet. There's still a lot of improvement. There's still a lot of expectation that we have as a government, but Nigerians, the citizens, also have of us. So we continue to collaborate. We'll continue to ensure that in whatever form we can support and help this great institute, we will do that. We will ensure that funding is adequately made, And like he mentioned, he led a team of chief medical directors from all states teaching hospitals in the country. And they came, of course, it was uniquely agreed that he is the first among equals. He was a leader. That's why they came to LASUTH to come and learn, to come and see things for themselves. And they paid me a courtesy visit where I admonished them and I encouraged them that what you've seen in LASUTH is a lot of hard work. It's a lot of commitment from the top. It's a lot of commitment from the state government, and it's a lot of sincere commitment from the staff. And so if they want to, which we want them to get to that level, they need to also think out of the box. And like he had said, he had given them a few of the tips and advice of what we use in Lagos. So CMD, thank you very much. Thank you to your leadership. Thank you to the management staff. And thank you to the nurses. I think we need to thank all of our Apex nurses. I know them when I see them because I know that the fear of nurses is the beginning of wisdom in medical health. Thank you very much, our nurses. Thank you for the support that you are given, to our health facility. But I still want more. I still expect a lot more. And so through our Ministry of Health, we've set up a body and we're working also with the federal. The thinking that we have is how LASUTH to become a medical university of health. How can we? It will be a tough one, but we believe it's doable. We cannot have all of these facilities and you just want to remain as a teaching hospital. You must be a citadel of medical learning. You must be a reference point of medical research, of medical transformation, not only in our country. And it's only when we achieve that collectively that we'll even see bigger funding coming to LASUTH, because it's a bigger deal. You know, what it means is that all of you even are getting bigger roles, bigger positions, bigger nomenclature, and bigger activity. And I believe that's what we need to do. So as the state government is thinking of it, please don't think that anybody is coming to take anybody's job. Think of it as a global solution of what we're trying to do, so that we can have, a learning institution that will take more doctors, that will take more nurses, that will take more pharmacists, that will take value chain in the medical profession, and all of you will be at the center of it, training people, educating people, so that we can scale up, the very challenging health deficiency that we have in our country. And with the ministry, the Federal Ministry of Health, with the Medical Council, we're working assiduously to see how we think out of the box, and we use LASUTH, as a clear model of how things needs to be done. And do I get a support from all of you in this line? Please, it will be a to thank our leader, the father of the nation, a man also that we in Lagos has uniquely, donated to our country, Mr. President himself, His Excellency Senator Bola Ahmed Tinubu, GCFR, for his visionary leadership at first the health sector, because there's so many things. There's so many things they're about, that they want to achieve under the global health coverage. There's so many conversations they're having with the subnational at this stage. And so I want to commend him, and through the Honorable Minister of State, thank him very much for his leadership role and for approving at all times projects of this magnitude here in Lagos and in other parts of the country, because it's not only in Lagos. We don't want only Lagos to succeed. We want every part of this country to succeed. We want every region in this country to succeed, because we know the pressure you have in LASUTH. We know people come as early as 5 o'clock in the morning to come and queue up in your consulting room just because they took a night bus from different parts of the country. We want them to also have first-class health facility in those various parts of the country, so that indeed, when we all spread it, we can share the risk and we can see, the benefits, as a nation to all of us. So once again, I want to thank our senior special assistant for putting up this edifice for us. I'm sure that the management and all the users of this facility will use it well. Like I said, our children will come in here, they will be sick, but when they come into here, they will get well and they get better. And to thank all of you that have come up into this very unique, simple but very unique occasion, and to thank the management and staff of LASUTH once again. Thank you very much, and it's indeed an honor to be here.
As the speeches drew to a close, in a poignant gesture of solidarity, Governor Sanwo-Olu and other esteemed dignitaries first revealed a newly donated ambulance, a beacon of hope for sickle cell patients in need of urgent care. A solemn moment unfolds. The official commissioning of the Sickle Cell Care Centre stands as a testament to unwavering dedication and collaborative efforts aimed at enhancing healthcare for all.
Okay. Thank you very much. For the glory of God, my honor all of my colleagues that are here to commission and hand over this sickle cell pediatric center. All of our pediatric patients and how to sickle cell. I mean, the glory of God and the benefit of mankind.